Welcome back to Holiday Showcase on KDKA-TV. Right now, Dr. Ian Bulow is from Revive Upper Cervical Chiropractic. Welcome back to Holiday Showcase, Doc. Good to see you again.
Thank you. It's good to see you, too.
Let's start at the beginning, and then you have brought somebody along, and we want to meet Amber because
yeah.
she's a patient and she has a great story.
Yeah.
Why upper cervical as opposed to everything? Why are you focusing just there?
Well, I tell you what, there's a lot of great medical practitioners in the Pittsburgh area. There's a lot. And there's a lot of great therapists and wellness providers. But what we find is missing in today's culture is that while we're all going out and trying to find the latest fix, you know what I mean, the latest drug, potion, lotion, mix, therapy, treatment, one of the things that we find are missing is that a lot of people have misalignments at the point where their head and neck meet. And that creates so many problems. I mean, lack of blood flow to the brain, tension around the spinal cord, of course, bad posture and tight muscles. And so for us, we like to say that healing starts at the top. So that's why we start there and then kind of go from there.
So it's as simple as somebody maybe had an injury or something years ago and they've had it for a long time and they don't realize that's the root of their body aches or pains?
Yes. The people that, and make no mistake, the people that we find that have the worst health, that are the most chronic and are the sickest and have a lot of medications, usually had a concussion injury when they were younger, they were in a car accident when they were younger, they had a bad posture, they were on their feet all day. A lot of little things add up over time. And it's like the camel in the tent, you know, a little bit at a time. And then one day someone wakes up, they're on 20 different medications, they're going to 10 different doctors, and they thought, I did not sign up for this. You know what I mean? So
and that's kind of what Amber was going through.
Yeah.
Amber, when did you meet the doctor? Under a year ago, correct?
Correct.
Give us a little background. You suffered from intense headaches.
Correct.
And you were everywhere.
Correct. About 10 years ago, first migraine started. And then from there, it was just trying, medications, other doctors, different kind of chiropractors. As far as me, I've been in the hospital at least 15 times. And as soon as I go in there, they look at my chart and they immediately give me morphine to actually make me go to sleep so it can completely quit. Vomiting, nausea, you're a vegetable in your own body.
And every time you went, did they always tell you the same thing, or did they have a different diagnosis every time?
I have gotten MRI scans. They say everything's fine, and they're like, here, take 800, Motrin, or take this, and that is masking the problem. It's not solving the problem. It's not fixing the problem. The doctor says it might get a little worse before it gets better. That's completely true. After my first adjustment, 2 weeks later, I got a really bad migraine. Ever since then, I think it was around March, I have not had a migraine since.
Well, doctor, I need to ask you. So when Amber comes in and she's been suffering for 10 years, and you notice something immediately?
Sure. We do what's called paraspinal thermal imaging, which is a fancy way of saying we measure for inflammation at the base of the head. If you look here, the arteries that supply a lot of the blood to the brain have to go through the neck. So we run a scan up the back of the neck that measures for inflammation at that point. And that's something that we do on day one. So on day one, we can see if there's inflammation there or not.
So you could zero in on it immediately.
Yeah. And I should say, it's not, I don't want to come across that we're saying medication is bad or people shouldn't have medication. But when somebody is going and having the same thing again and again and expecting something different, that's Einstein's definition of insanity.
It's not going to change.
My challenge to people is that, look, if you're sick and tired of being sick and tired and you've been to all the other professionals, let's try something different. Let's change what we're doing and try and change the result that we get.
How have you felt in the past 6 or 7 months, Amber?
Completely 100% better. Also, just acid reflux has gone away, digestion improved. Just you feel whole, just your well-being is just completely, it's better. And I urge people, if you are like, oh, that sounds like me, or I have a headache, nip this in the butt before you get like me.
Right. So don't be like Amber.
Right.
All right. So doctor, he changed your life.
Yes, I mean, every time I go into the practice, I just want to hug everybody because everyone is honestly so nice, and they're really out for your
Amber's
well-being.
a hugger, isn't she, doctor? Amber's a hugger, right. If you want some more information, call Dr. Bulow at 724-772-7060 or log on to revivepittsburgh.com. If you'd like to be on our show, that's easy too. 412-575-2400 or email at showcase@kdka.com. That does it for today's show. I'm John Klein. Have a great holiday weekend, and thanks for joining us here on Holiday Showcase.